Today's show is brought to you by Boat Patana of Boat Avenue and Shambhala, Phuket. For more information on their properties, see the link in the description below. Good morning, Thailand. It's Friday, the 26th of August, and we'd like to welcome Jay and Mike to today's program. Michael, it's your last day. You've been in here giving us your thoughts about things over the past week, but we are giving you the shove and sending you back to your office job. Now, last night you played a great prank with your family when you told them that although they thought it was serious, that the UK has changed Thailand and put it into the red list. That sort of backfired on you.
Yeah, agreed. So, yesterday evening, I told my parents that the UK was adding Thailand to the red list. They panicked, and I was only playing around. Turns out that the prophecy has come true. This morning, Thailand has been added to the UK red list, which...
Well, it means that anybody from the UK who's currently in Thailand, if they want to go back to the UK after the 30th of August,
yes,
they would have to do 10-day quarantine.
Correct. I mean, my take on it, that in itself, the actual period that they allow you to get back within, I understand for Europe, which is maybe an hour, distance or 2 hours, and you can potentially drive. Them changing the rules and giving you basically 48 hours notice to head back to the UK doesn't really help people here. People will be scrambling to get flights back if they want to avoid this 10-day hotel quarantine, which is not great. So
let's have a talk about your options and about the impact of this soon. But let's start with Jay and go through the COVID numbers for the past 24 hours.
Sure, Tim. Today in Thailand, we had 273 new COVID-related deaths, 18,702 new COVID infections. Currently, we have 185,200 people still in care in hospitals and field hospitals in Thailand, and we had 20,163 people who have been discharged from hospitals. This week in Phuket, on Wednesday, we had 186 new infections within the island, and on Thursday, 170 new infections.
So sobering numbers there from Jay. We'll certainly get to discuss the impact of some of those numbers on the Sandbox soon. We've also got some discussion about the bizarre press conference yesterday or late last night with the head policeman up there at the Nakhon Sawan police station, well, the former head policeman. So we'll get to that on Good Morning Thailand right after this. We'll just pop downstairs to get some fresh air. The policeman at the centre of the alleged torture and killing of a drug suspect in Nakhon Sawan, Thitisan Utthanaphon, aka Joe Ferrari, has surrendered to police in Chon Buri late yesterday afternoon. In a bizarre presser, flanked by police and taking phone-in questions from Thai media, the fugitive policeman, Thitisan, admitted to using plastic bags on the 24-year-old drug suspect, but denied he was trying to extort money from him. The 39-year-old former policeman claimed it was the first time he'd tortured a suspect and denied having been involved in corruption. Explaining why he used 6 bags to cover the suspect's head, he said he did not want the suspect to see his face. He also said that he'd ordered junior police at his station to remove the CCTV cameras in the room where the incident happened because he was shocked by the victim's condition and had never experienced such an incident. After chatting to Thai reporters for a quarter of an hour, Thitisan was asked what he thought about his staff handing the CCTV over to senior police, but the National Police Chief Suchat Tirasawat interrupted, saying he didn't want reporters' questions to affect the case. It was earlier rumoured that he'd fled to Myanmar, but that he'd then called a senior policeman who convinced him to surrender. With the number of active COVID cases on a slow downward trend nationally, the Public Health Ministry plans to make a proposal to ease measures for those who are fully vaccinated or who have passed COVID-19 tests in provinces classified as dark red or red for high infection rates. The ministry plans to propose dine-in services at restaurants to be allowed for those who are vaccinated and those who test negative for the virus. Under the proposal, domestic flights from dark red zones, which are currently suspended, would be allowed for passengers under the same criteria. The proposal will need to be approved by the CCSA. Under the proposal, both staff and the customers at air-conditioned restaurants in dark red and red zones would need a certificate declaring they'd received 2 doses of COVID-19 vaccines or test results, either from antigen or PCR tests. Today's COVID-19 numbers in Phuket pushed the Sandbox's overall total cases above 3,000, bringing the weekly total to over 900. That's 10 times the original threshold for re-evaluating the Sandbox. 3 new Sandbox infections were found in international travellers. 356 people are currently hospitalised in Phuket with moderate to severe symptoms of COVID. Per capita, Phuket's daily infection numbers are now the same or in excess of Bangkok's caseload 1 month ago when it was at its peak. Meanwhile, the attempt to restart the battered tourism industry with the Samui Plus model, which started on July 15, has shown a low uptake from international visitors. Up to this Wednesday, Samui Plus has only welcomed a total of 431 international travellers. 34 of those have continued on to Koh Phangan and 22 to Koh Tao. More than half of the travellers have come via the Phuket Sandbox, but the flight connecting the 2 islands was suspended between August the 3rd and last Wednesday when it was resumed. The president of the Thai Hotels Association Southern Chapter for the East Coast blames the costs associated with the scheme, including medical fees and 3 swab tests which cost 15,000 baht per person. He said the stringent measures requiring tourists to spend the first 7 days in area quarantine facilities in Koh Samui is another concern, as most tourists demand quarantine-free travel. More people arriving here at the office, so I'll head back into the studio, and we've got our regional headlines coming up, but in just a moment we'll go back to myself, Jay and Mike, and continue on with the program on Good Morning Thailand. You're on Good Morning Thailand and it's Friday. Hope you've got a good weekend coming up. Plenty to talk about, everybody. What do you want to start with, the Joe Ferrari or Phuket and COVID?
Let's start with Joe Ferrari, Tim.
All right, what a weird media conference that was last night. Did any of you see it?
I saw parts of the video, but I've never seen anything like it before. Do you know about this, Mike?
I caught up on it this morning, and it is very, very bizarre.
Bizarre to just allow him to talk to the Thai media on the phone as a charged felon. It's completely something that I suppose you can put into the list of only in Thailand. But I loved some of the responses he gave to the Thai media, the sort of things you might expect to come out in a court case. But asked to why he was putting the plastic bags over the head. Where are we? Explaining why he used 6 bags to cover the suspect's head. He said he did not want the suspect to see his face. And there were plenty of other things asked. He also said that he'd ordered junior police at his station to remove the cameras in the room where the incident happened because he was shocked by the experience and had never had such an experience. And all sort of strange, but Mike, you sort of have got a different feeling about the whole thing.
I mean, the whole thing's bizarre. I think the first question I have, which we don't know, is why did he hand himself in? I mean, my guess is there's two scenarios here. Either A, he's cut a deal with the Thai authorities to get a reduced sentence, and if you hand yourself in, then X will happen. Otherwise, why would he? Or the second one is that there is this off chance, which I know sounds utterly ridiculous, that he was actually trying to bust a drug ring, but just went a bit too far. I mean, I would imagine...
By murdering the man?
By murdering the man, yes.
Yeah, that's a bit far.
Well, no, I think there is a very remote possibility that he didn't intend to kill him.
Well, clearly the defence lawyer is going to sort of try and trump this up, that he's a vanguard for the drug suppression in central Thailand, blah, 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 how that washes with the court. I suppose in Thailand we do generally see a lot of people who confess and who present themselves to police, there is some sort of shaming or, shame to your family if you don't surrender yourself. This seems to happen very often in Thai culture.
That's right, Tim. And actually, the police officers or the police department was actually said that they wanted him to actually come in to not tarnish, the police themselves and what the police stands for in Thailand. And to what Mike said earlier, Joe Ferrari was quoted saying, "I intended to get information so I can destroy the drug business and protect the people of Nakhon Sawan." So even though what he says sounds like he was, trying to stop the drug business, but what he actually did, there's no real explanation for that. What he did was absolutely horrific and unacceptable.
And as to where he got a lot of his money, he seemed to be playing a bit of a game with Thai law
Yes.
in regards to luxury sports cars.
That's correct. So actually, Thitisan, former ex-cop, he is known for confiscating 368 illegal vehicles, including high-end cars. Now, in Thailand, the police are basically, they're given incentives to go and do this. And if you give a tip for high-end illegal cars, you get 30% of the proceedings. So once they get the car, they sell the car, and from the proceedings, the person who gave the tip gets 30%, and the arresting officer gets 25%. So if Joe Ferrari is the person who finds the car and is the arresting officer, he gets 55% of the proceedings of a Ferrari. So that's how he's collected the money, and which kind of makes sense why he has a mansion and all these luxury cars. Now, is he the best cop in Thailand, getting 368 illegal vehicles, or does he have incentives to go and hunt down these people?
Well, the incentive is there, obviously.
Yeah, I think there's definitely a plausible reason as to why he has this mansion and why he has his cars. I mean, if I was in the police and they told me that I was going to get 35% of the proceedings of selling luxury sports cars from busted drug rings, then I'm incentivized to go out and bust drug rings as hard as I can, which might be what's actually happened in this video. I mean, well, look, whatever he's done has gone way too far. This isn't 24 with Jack Bauer, undercovering, terrorist plots. It's more... You
What's
can't...
24 with Jack Bauer?
So it's a TV show in the US where there's a guy that's, working out terrorism, and he goes to the extreme, cutting off fingers and stuff to get the answers from the terrorists.
Oh, okay.
But I think in the drugs ring, I don't think you can do this.
All right, so Michael Kenner, defence lawyer for this policeman, you've got 1 minute for your roundup on this case before the judge makes his decision. Go.
Okay. So the defendant, has busted X amount of drugs rings. He's done this successfully multiple times. In this case, he's got the good of the nation at heart, trying to bust the biggest drugs ring in Bangkok. He's gone way too far.
God.
I mean, you want me to be the defence lawyer? You can't switch it around
and
then say, "Oh my God!" It's like, this is my role. I'm the defence lawyer.
Yeah. I'm the judge having a quiet snigger.
Look, it's hard to believe. I'm just saying there's a very remote possibility that that this went way too far, but it does not look good. Let's just say that.
All right, we'll have another quick break. We've got our regional headlines coming up. Then we're going to have a talk about your options for your parents who are in the Sandbox situation. It's a really good real-time example of what's happening here. So we'll come back and have a talk about that with Jay and Mike here on Good Morning Thailand.
Myanmar's coup leader is considering changing the country's electoral system from the existing first-past-the-post model and towards a form of proportional representation. Japan stops the use of 1.63 million Moderna COVID-19 vaccine doses due to reports of contamination. US VP Kamala Harris took another jab against China during her trip to Vietnam, warning the US would continue to push back against Beijing's claims in disputed Asian waters. Malaysia reports a record high of 24,599 new COVID-19 cases and another record high 393 deaths. Japan has hospitalized their first Tokyo Paralympic participant with non-severe symptoms of COVID-19.
Back with Jay and Mike and me for Good Morning Thailand, last day of the week, and let's move to the Sandbox. And just to bring you up to date, if you're new to the program today, Mike's parents came from the UK. I think they arrived on Sunday.
Yes.
and they came as part of the Phuket Sandbox. And because they're from the UK, they're now embroiled in this latest situation where the UK has decided to put Thailand on a red list, which means any people who are still outside of the UK after the 30th of August, I think at 4 a.m. UK time, will have to do a 10-day quarantine. Mike, what are your parents' options?
So the options are, I mean, they flew Thai Airways, so the option is to go home this evening. There's a flight out at 11:50 in this evening to get back before this, mandatory requirement of 4 a.m. on the 30th, which is a very short period they're giving, travellers to actually return back to the UK, which is definitely a question. The second option is to obviously to stay the length of the holiday and go back and do the 10-day quarantine, but I think this isn't an option that's viable. I don't think anyone really wants to be sat in a hotel room.
So the quarantine in the UK is at an ASQ, a hotel. You can't go home and do it.
Correct. And I think it's probably a more miserable hotel than what you would get here. But yeah, I'm guessing. The third option is to stay and the duration of their trip and then head to Dubai, which is on the amber list, spend 10 days there. So,
okay.
And then head back to the UK. So that is definitely an option. I think the question for them would be, what would they do in Dubai for 10 days? But that's okay. And the last option is every 3 weeks they update the travel policy for the UK and change the colours on their list, whatever they have, to wait 3 weeks. They're meant to be here for 3 weeks anyway, so it'll be another week on top of what they're going to stay.
And that they can extend.
Correct.
Right.
I think the question is in relation to insurance. My dad is late 60s, and he said this insurance is only valid for his trip. So can he get health insurance and COVID insurance to protect him while he's here? I think you probably could. To stay and see what happens if the UK update their list and remove Thailand from the red list and move it to an amber colour. So they're the options they're considering. It's a challenging one, definitely.
Right, well, I suppose the other situation we need to look at is that Phuket, as the sandbox, is now in a situation where it's seeing rising cases. Now, I think over 920 for the past 7 days. If you want to put that into perspective, per capita, Phuket is now in a situation where it has got more cases than Bangkok had a month ago when it was at its peak. So the problem, I suppose, for the public health officials is what to do about that, because currently Phuket is considered on an orange zone, and we have a large amount of freedom of being able to go out, move around, as long as we wear a mask in public. So I'm going to put you both on the spot. So starting with Jay, I'm going to make you the head of the Phuket Public Health Ministry.
Okay.
And tell me what you are going to be recommending. So Jay, you are the head of the Public Health Ministry. Congratulations.
Thank you.
What are you going to do?
Well, in my opinion, since the cases are increasing so much, and like you said, per capita, it's a lot more than Bangkok, and Bangkok has a lot of restrictions. People are,
curfew.
It's curfews, it's a red zone, people are staying indoors, but Phuket basically has very little restrictions. People like to talk about, oh, you can't do this, you can't do that, but you can almost do everything. People can go out shopping, they can go to restaurants, they can just go around anywhere as long as they have a mask.
You can go to the beaches, you can go hiking, you can go sailing.
Exactly. And so we're reaching the point where cases are going above 200 every day, and they just seem to be increasing and not falling down. So apart from stronger restrictions and just waiting it out, I don't really see any other option.
All right, so Michael, I've sacked Jay.
Yeah. So you should.
I'm now nominating you as the head of the Phuket Public Health.
Okay, you ready, guys? All this talk about cases per capita is not the right metric we should be voting on. What we should be looking at is cases per square mile, because you could have a very sparse area like Phuket where it's not crowded. So you could have 10 people here, and the chances of you getting infection would be lower, right? But not a densely popular area like Bangkok. So there is a wider, size of country, and so that take that into account. The second is we should not be putting people in hospital who have COVID. We should be putting people in hospital that are sick. Let's free up the beds for the sick. So if you have COVID with no symptoms, you should not be taken to hospital. You should have to do home quarantine, similar to what other nations are doing. I think that whole concept of if you've got COVID, we're going to take you to hospital for 2 weeks is utterly ridiculous.
So I have a question
Yes.
to the head of the public health in Phuket. 356 people are currently hospitalised in Phuket with moderate or severe symptoms of COVID. What happens if we run out of beds?
Well, I think in relation to if you put moderate symptoms in, so what if I have a cold, I have to go to hospital?
I'm not sure what they call moderate symptoms, but I'm assuming that they are such that they need to be hospitalised.
Fine. But if the rules are, if you have COVID, we're taking you to hospital, there is a lot of hospital beds that are being utilised for people that do not need them. Not just in the hospitals, but also the converted hangars, in field hospitals that are making things. So we need to free up the beds for actual sick people, not people who are not sick, that are utilising valuable space. So that would be one of the first changes I made to the amendments. Secondly, we have a very heavily vaccinated population in Phuket. I think the numbers are 92% or 90% have their first vaccine.
Have had their first vaccine, and something like 65, 68% who are fully vaccinated.
Okay, so we are a vaccinated state of Phuket currently. Yeah, we're probably hitting critical mass of vaccinations. I mean, could they get boosters? Could they bring in, Moderna and maybe Pfizer and some other ones to kind of give us a top up? Yes, but if you cannot open up Phuket with everyone being fully vaccinated, if not now, then when? What do you do? We're going to see this out for years and years and years and sit here. So I think the reality is we need to be focusing on number of people who are dying in Phuket. Now, the question I have for my health minister, Tim, is how many people are dying in Phuket for the last 24 hours?
I think in the last 24 hours it's been one. I think we're up to about 5 in the last week. I don't have those numbers at hand. I'm not a very good public health minister for Phuket because I don't have those numbers at hand.
Fine. So assuming it's just one, are we going to close the whole of Phuket for one death? Which probably might have happened already. I'm not saying that would have, but I mean, that is the reality we're in. I mean, it just sounds to me absolutely ludicrous. And, that is only my opinion. I'm not saying I'm right or wrong. So for the people who want to say, listen, Michael's absolutely lost the plot here, this is just what I believe. You cannot shut a whole state for one death.
I don't think shutting the whole state. I agree with Mike that there doesn't need to be a need to shut the whole state, but just re-amend the restrictions, because we basically have no restrictions currently. So people coming in from the Sandbox are actually quite well vetted, and they're tested properly. So Sandbox is doing fine, I think.
But we're fully vaccinated here. I mean, they are vaccinating everyone. So what do we do? Is this for life? This is the question. Every single, they've gone out vaccinations. There's not people now who need vaccinations in Phuket. They're looking for them. Maybe the second jab.
Yeah.
So when does this stop? That is the question. When does this stop? Is it going to carry on going? So it's like, if not now, then when? That's the question. At the current vaccination levels, we need to basically open up.
All right, so we're just going to ask our Phuket Public Health President to just calm down a bit and don't take your stress pills. We're going to have a quick break, look at Thailand's weather, and then we're going to come back and have a talk about, I'm using the very dramatic term of vaccine apartheid, but let's have a good talk about this right after this on Good Morning Thailand. Clear skies across the capital, fair weather over the next few days, but there will be a few showers and the overcast conditions persist. Top temperature 32 tomorrow, down to 31 on Sunday. Checking the weekend on the Sandbox Island, and 28 over the next few days. Looks like some of the rain we've been having over the past 3 or 4 days will abate. Low temperatures down to just 27 overnight during the weekend, so very humid. Up in the northeast of Thailand, 29 is the top today, dropping down to 27 during the next few days. Temperatures down to 23 overnight. A few showers expected, although there will be some sunshine as well. Let's head up to the north, where we expect a little bit more sunshine over the next few days, although the showers from the low season will persist. Temperatures down to 21 degrees. To the Gulf Coast, and very clear skies, a measurement of only 17 there today. Temperatures of 29 today and tomorrow, then down to 27 on Sunday. There will be some cloud around and a few showers. Temperatures down to 24 overnight. And to Chon Buri, and we've got fair skies there at the moment. 24 is the low for the next 3 days. 28 and 29 is the top for some very pleasant days. A little bit of cloud and rain could be expected. Welcome back to Good Morning Thailand. Mike's had his Xanax and a cup of tea and calmed down a bit. Jay, we're having a talk now about something that I think is, I mentioned this yesterday vaguely, but quite a few of our viewers jumped on it. And we're now in a situation where the double CSA are considering allowing people who are fully vaccinated and have got papers to prove it to go and sit in restaurants and be served, whilst people who are not vaccinated will have to walk past unable to go into that restaurant. So I say to both of you, what do you think about this? I mean, we can understand perhaps that this might be a policy on an aeroplane where it's ferrying people from one place to another and they want to stop the spread of the disease. But what do you think about people having to walk around with papers saying that they've been vaccinated?
Well, to me, it doesn't really make sense because we don't even have enough vaccines for people in Bangkok. So we're talking specifically about Bangkok. So if we have a lack of vaccines, how can we say no to a person, oh, you're not allowed in because you don't have a vaccine? What if he says, I've tried to register, I've tried to get one, but I can't?
Well, we get hundreds of emails every day, literally hundreds of comments and emails every day of people saying, I want to get vaccinated, but I can't.
Exactly. And there are also people who can't get vaccinated for a lot of reasons. Health reasons, money reasons, that maybe they don't have the time or are unable physically to go and get a vaccination.
Or perhaps they don't actually want the vaccine.
That too, exactly. And so, you even have cases where maybe some children don't have it. Are we not going to let children in? A family wants to come for a dinner outside. The mum and dad, because of their age, have got the vaccine, but the children aren't allowed. Keep them at home. How do we differentiate this? Who's allowed in? Who's not allowed in? What's okay? What's not okay? There's a lot of, misconceptions, and I think people are going to be enraged.
And if restaurants do it, then what about hotels and shopping centres? On it goes. Mike, what are your thoughts? I'm calling this vaccine apartheid, by the way.
So I think what do you do is the question I have. At the moment, the restaurants in Bangkok are shut. You cannot eat in. You cannot really go to shopping centres. All the restrictions in place. Now, is it fair to say to everyone, listen, we'll wait till everyone is fully vaccinated to then open this up? Okay, fine. So we might be waiting 3 to 6 months till everyone is fully vaccinated to open this up. Or do we say, look, should we restrict these people who have had the vaccination, who can go and eat in these restaurants, and just let them eat? Yeah. Well, what do we do? Okay, no, it's not fair. Let's just close everything, and let's keep everything morally correct. We'll close everything for 6 months, so everyone is treated the same. I mean, the reality is that probably can't happen. So I think.
So you're going to sit in the restaurant next to the window, eating your cordon bleu chicken, and look out the window at the poor people who haven't been able to either afford or able to be vaccinated as they wander past, pondering what might be happening if I could go to a restaurant.
So the other question is we all sit in our houses together and keep the restaurants shut because we don't want to create this system of privileged or fair. But the reality is, I think the vaccine program in Thailand is not based on privilege. Is that correct?
Well, of course, it's not meant to be, but the reality is that it seems that the people who have either got work permits, which means they've got jobs, or the people who are in a situation where they're able to get their name up to the front of a queue. There may even be situations where people have paid to be in front of queues. We have many reports of that, or even foreigners who have been able to pay to get vaccinated. So I think there is a certain amount of privilege involved here. I mean, Thailand is not what you would call the country with the most fair system and equality across the social classes. So I'm uncomfortable about this.
I don't think anyone is comfortable with this. I think, what do you do? We can always say this is unfair, this is ridiculous, this is outrage, but is the other option to keep everything shut? And I think we've got to be like, which option provides, people with the best choices? So is there another feasible option here? That's the question I have for you, Tim.
Well, I'm not sure, and I'm not here, I'm not the public health, I wasn't nominated. So I'm going to ask Jay, would you be comfortable going, because you're fully vaccinated,
yeah.
How do you feel about going to sit in a restaurant and think there might be people walking past who can't come into that restaurant?
If I was there, I probably wouldn't go because I just don't agree with it. It just doesn't feel right to me because I have friends, I have family members, I have a younger sister who doesn't have a vaccine. So do I just go out with my parents and leave my sister back home? Do I only invite my vaccinated friends and have a vaccinated dinner? And where does it start and where does it end? So we start with restaurants, and then what about public transportation? Are we going to have vaccinated buses? You can only you can only go into a taxi if you're vaccinated. You can only go into certain buses because you're vaccinated. I just feel like it could get out of hand. So personally, I'd probably just choose not to go.
It sort of reeks of South Africa in the 1980s, the US and the southern states in the early 60s. We can even go back to Germany in the 1930s, where there is this sort of socially acceptable apartheid. And I'm not sure if there's another way around it, but I am uncomfortable about it.
But you're already seeing it happen.
Yeah.
So you're in Phuket. Do you have family outside of Phuket?
No.
No, but they can't. If you did, they can't come into Phuket unless they're double vaccinated. So you already can't go to areas unless you have double vaccination. You cannot travel on some transportation unless you are double vaccinated. This is fact. This is already happening.
You've not been double vaccinated.
Correct.
Okay, so you can't go to the restaurants. Bad luck.
Yeah, fine. I will be on the list to be double vaccinated.
Okay.
It needs amendment, I think. I don't think the idea is bad. Mike's right. We can't just be like this forever. How many years can we go on like this? But there needs to be a better solution than, only vaccinated allowed, unvaccinated not allowed. They need to be understanding. They need to make some amendments that makes everyone reasonably happy. Not everyone will be happy, but I think we need to find a balance between what Mike's saying and what I think.
I thought we had a system whereby there's social distancing, mask wearing, washing your hands, checking your temperature when you go into these places, that already made a certain amount of surety that you are less likely to be infected in these situations. Why add another layer, like insisting on paperwork? I would have thought we've already got enough layers of restrictions and taking care of people already in place.
Well, I think you could remove some restrictions to allow for this to happen. I think the issue is that for the people that don't want to be vaccinated, and I get that, right? I don't really want to be vaccinated, but I am. And who are very against this. What choices would there be for these people? That is the more concerning question. I think for the people who are waiting to be vaccinated, okay, fine, your time will come. In the next few weeks. I mean, they're rolling out hundreds of thousands a day now. So, we're going to see large amounts of percentages of the population be vaccinated very, very quickly. I think it's for the people who can't get vaccinated because of health reasons or just choice. What would be the outcome for these people? I think that is the real question at hand here.
And interestingly, of course, we want to know what your thoughts are on this, and you can comment underneath, or you can go to Thaiger Talk and give us your thoughts on these issues. Gentlemen, we've run out of time. So, Mike, thank you for popping in this week.
Thank you very much.
Stirring the pot. Jay, thanks for popping in today, as usual.
Thank you, Tim.
And you got Venice of the East on Monday.
I do, yes.
So get studying on that. Thank you very much for joining us this week on Good Morning Thailand. Of course, we hope you have a fantastic weekend, and we look forward to talking about all your comments on our Tiger Bites program as well. But for now, thanks for watching.